Hi there, my name is Nick Fletcher and I'm a pediatric orthopedic surgeon at the Children's Healthcare of Atlanta and Emory University. Today I'm going to be discussing our recently published paper entitled Doing Our Part to Conserve Resources, Determining Whether All Personal Protective Equipment is Mandatory for Close Reduction and Percutaneous Pinning of Supracondylar Humerus Fractures. The genesis of this project really started at the beginning of the COVID-19 pandemic when local hospitals had a shortage of PPE. We were having our weekly discussion about different necessary procedures that were going to be done, and it turned out that there was a discrepancy in how different surgeons were prepping out their supracondylar humerus fractures. We therefore decided to embark on a retrospective review of 1,270 children treated at our institution over a 4-year period with close reduction and percutaneous pinning of a supracondylar humerus fracture. About a third of these patients were treated with a semi-sterile technique, which we defined as the surgeon and the scrub tech using gloves but no gown, and the patient's arm being prepped with 4 towels but no drape. Of course, the elbow was prepped sterilely. 2/3 of the patients were treated with a standard sterile prep, including a full drape and the surgeon and scrub tech both wearing full sterile gown, gloves, and a mask. One of the surgeons in the semi-sterile group actually did not wear a mask during the procedure either. What we found was that there were 3 pin site infections all occurring in the sterile group. There were no pin site infections in the semi-sterile group, and there were no exposures that we are aware of to any of the team members. Looking at cost of supplies, it appeared that we saved about $100 per patient in supplies, and using previous studies that have shown about a 10-minute difference in the procedure time using the semi-sterile technique, and a conservative estimate of about $30 per minute, that we would save about $300 per patient. If we extrapolate this out to the nation, we would find that we would save about $4 million annually in supplies and operative room time. We would also save 20,000 sterile gowns and prep kits. We think this is a very useful study. I personally have changed from a full sterile prep kit to a semi-sterile technique. And I think that future studies should include similar evaluations on the need for full prep in other minimal risk procedures such as close reduction and percutaneous pinning of finger fractures, amongst others. We know that this has been safe in things like placement of traction pins. We also think that this study should prompt all surgeons to look at their own practice and consider changing their approach to prepping for these low-risk procedures. Thank you very much for your time and for your willingness to read our paper, and I hope that you all stay safe.